Welcome to VR Nursing Academy, produced by राजेंद्र सिंह। आज का अपना टॉपिक है थायरॉइडेक्टमी। First question. A nuclear plant experienced a leakage, and all involved workers were brought to the emergency department for treatment. The medical team prescribed potassium iodide for the workers to block radioactive iodine to be absorbed by an organ in the body. Which of the following organs is the most sensitive to radioactive iodine? Option A. Kidney, B. Brain, C. Thyroid, D. Lungs. In which correct answer is option C. Thyroid. Next question. Progressive enlargement of a multinodular tracheal compression including pain at the site of the ear and jaw, difficulty swallowing. Change of pH breath by compressing the esophagus. There is in otherwise the patient is at risk. What is the preferred treatment? Option A. Surgical resection of abnormal thyroid. B. Thyroid hormone treatment. C. Iodine treatment. D. Radioactive iodide treatment. In which correct answer is option A. Surgical resection of abnormal thyroid. Next question. The nurse is assessing 45-year-old woman whose thyroid enlarged. A blood sample was collected and an analysis confirmed diagnosis. TSH 0.12. Normal level is 0.4 to 6.5. Free 210. Normal level is 50 to 140. Thyroxine T4. Normal level is 4.5 to 11.2. Option A. Incision and drainage. B. Adrenalectomy. C. Polythyroidectomy. D. Thyroidectomy. In which correct answer is option D. Thyroidectomy. Next question. A patient returned to the surgical unit from the thyroidectomy. The nurse observed that the arousable blood pressure 90/60 of Hg, heart rate 108. What immediate action should the nurse take? Option A. Assess the back of neck surgical dressing for bleeding. B. Place client in modified Trendelenburgs. C. Administer intravenous fluids as ordered. D. Recheck pulse and blood pressure. In which correct answer is option A. Assess the back of neck surgical dressing for bleeding. Next question. A nurse vein is aware a positive caustic sign indicate. Option A. Hyponatremia. B. Hypocalcemia. C. Hyperkalemia. D. Hypomagnesemia. In which correct answer is option B. Hypocalcemia. Next question. A 25-year-old man is in the surgical ward on his first post-operative thyroidectomy. He appears drowsy but he is able to respiration by nodding head. He is developing mild restlessness. What is the initial recommended goal of care? Option A. Assess the bilateral vocal fold mobility. B. Monitor for swelling on the neck. C. Monitor vital signs of thyroid storm. D. Monitor for vocal cord paralysis. In which correct answer is option C. Monitor vital signs of thyroid storm. Next question. Complication of thyroidectomy. Option A. Vocal cord injury. B. Bleeding. C. Distension. In which correct answer is option B. Bleeding. Next question. The nurse care for a 65-year-old woman who history hypertension, hypothyroidism and elevated cholesterol levels. She takes tablets daily for each of the health problem. The doctor orders a routine dual X-ray absorptiometry test that showed decreased bone density. Which medication most likely contributed the test result? Option A. Cholesterol absorption inhibitors. B. Synthetic thyroid hormone. C. Antihypertensive. D. Statins. In which correct answer is? Option B. Synthetic thyroid hormone. Next question. Patient is being admitted to the recovery room following a thyroidectomy. The back of the neck wound is covered with dressing. During the first 15 minutes, the patient started working and having diarrhea. A general assessment is performed with special attention given for the high risk for hemorrhage. Where would bleeding most likely occur? Option A. Stool. B. Dressing. C. Vomiting. D. Back of neck. In which correct answer is? Option D. Back of neck. Next question. A post-thyroidectomy patient transferred to ward and developed tetany. The nurse suspected that patient has option A. Hypocalcemia. B. Hyponatremia. C. Hyperkalemia. D. Hypermagnesemia. In which correct answer is? Option A. Hypocalcemia. Next question. A 35-year-old man has undergone a subtotal thyroidectomy ago. He is suspected to develop tetany after the surgery. Which of the following symptoms best indicates tetanus? Option A. Pain in hand and feet. B. Bleeding on the back of the dressing. C. Tension on the suture lines. D. Tingling in the fingers. In which correct answer is? Option D. Tingling in the fingers. Thanks for watching. Please like, share, and subscribe the channel, and press bell icon.